Welcome to my channel, Brainies. In today's video, I'm going to talk about the differences between the Romberg's test and the timed up and go test, that is the tuck test. So the differences I've been categorized into three columns: the features, the Romberg's test, and the timed up and go test. The purpose of the Romberg's test is to assess the static balance and the proprioception, whereas the tuck test assesses the dynamic balance, mobility, and the functional movement. The type of test in Romberg's is the static balance test, whereas in tuck test it is the dynamic functional mobility test. The primary systems assessed in case of Romberg's test are the sensory systems, which includes the proprioceptive, visual, vestibular, etc. And in case of tuck test, the primary systems assessed are the musculoskeletal and neuromuscular system, the strength, coordination, gait, and the balance. The procedure of the Romberg's test is: the patient stands with feet together, eyes open first and then eyes closed for about 30 seconds. Whereas in timed up and go test, the patient stands up from a standard chair, walks for 3 meters, turns around, walks backward, and sits down. The time taken is measured. The equipments which has been required in case of Romberg's test is nothing as such important, which is just a firm surface on the floor. In case of tuck test, it is the chair, stopwatch, and the 3-meter distance which has been marked on the floor. Eyes open and eyes closed. In case of Romberg's test, the test is first performed with eyes open and then with eyes closed. In tuck test, the test has been performed throughout with eyes open. The main outcome measure in Romberg's test is the ability to maintain the upright posture without excessive sway or loss of balance, whereas in tuck test it has been measured in seconds, that is the duration of that is the time taken to complete the task. Interpretation in Romberg's test is: the loss of balance or increased sway with eyes closed suggests the proprioceptive or vestibular dysfunction. In tuck test, longer time indicate the reduced mobility or the increased fall risk the increased fall risk. The typical cutoff for abnormal result. In Romberg's test, if the patient is unable to maintain the stance for 30 seconds, especially with eyes closed, which is indicated as abnormal. In case of tuck test, greater than 13.5 seconds indicates the higher fall risk. Clinical use. In Romberg's test, it identifies the sensory ataxia, vestibular dysfunction, or balance deficits in neurological patients. In tuck test, it assesses the functional mobility, fall risk, and rehabilitation progress in geriatrics and older adults, that is the neurological patients. The patients commonly tested, that is the population I'm talking about, the neurological condition, it is example sensory ataxia, multiple sclerosis, peripheral neuropathy patients. Whereas in tuck test, it is the older adults, stroke survivors, Parkinson's disease, and post-surgical patients. The advantages of Romberg's test is it's very easy to administer, very quickly it can be progressed, and no specialized equipment is needed, and it's a easy bet test. And in case of timed up and go test, it reflects the real life movement, and the test is reliable, sensitive to functional changes. The limitations are Romberg's test evaluates the static balance, only the static balance, and it may not detect the functional mobility problems. In tuck test, the limitations are it is affected by multiple factors like muscle strength, cognition, the gait speed of the patient, etc. The typical duration of Romberg's test is about 1 minute, and here it is in tuck test it is 1 to 2 minutes. The interpretation of the Romberg's test: the negative Romberg's test, that is which has been considered as normal, the patient maintains balance with minimal sway for 30 seconds with both eyes open and eyes closed. It indicates intact proprioception and vestibular function. The positive Romberg's test: in case of positive Romberg's test, the patient shows increased sway or loss of balance when the eyes are closed. That is, it suggests a proprioceptive or sensory deficit such as the dorsal column lesion of the spinal cord, peripheral neuropathy, and sensory ataxia. Loss of balance with both eyes open and eyes closed, it indicates a cerebellar ataxia or the vestibular dysfunction and not purely sensory. So, duration with eyes open, the normal finding is the patient should be able to stand with 30 seconds or more with minimal sway. And the duration with eyes closed, the normal finding is the patient will be able to stand for 30 seconds or more without losing balance. And sharpened Romberg's test tandem stance, the healthy adults will take 10 to 30 seconds, and foam Romberg's, that is on a compliant surface, the increased sway is normal but loss of balance suggests impaired sensory integration. A short summary, and this is the interpretation of tuck test. 10 seconds or less is the normal mobility. 11 to 12 seconds, it is typical for the older adults. 13 to 14 seconds, borderline. More than 13.5 seconds, it indicates increased risk of falling. More than 20 seconds, it is limited functional mobility, and more than 30 seconds, the patient requires assistance and there's a greater risk for fall. And normative values are 60 to 69 years, it is approximately 8.1 seconds. 70 to 79 years, approximately 9.2 seconds, and 80 to 99 years, approximately 11.3 seconds. And this is a quick summary of the entire content which has been delivered so far. That is, the time required here is 1 minute, and Romberg's. In tuck test, it is 2 minutes. And the main focus here is the proprioception sensory integration. In tuck test, it is a mobility, gait, and fall risk. And here it is best used for neurological assessment in Romberg's, and in tuck test it is a functional mobility assessment. Outcome measures, it will be here in Romberg's test, there's an ability to maintain stance, and tuck test it is time in seconds. The fall risk indication here in Romberg's is positive Romberg's with eyes closed, and tuck test it is greater than 13.5 seconds. Thank you so much for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again.